Welcome to Logical Ayurveda. Today we are going to learn about difference between Vyagradhi Kashayam and Dashamula Katutraya Kashaya. Both are used in respiratory conditions. So what is the difference between Vyagradhi Kashaya and Dashamula Katutraya Kashayam and where to use them, in what conditions exactly we can give them? Let's dive into the details. So Vyagradhi Kashayam, the main ingredient of Vyagradhi Kashayam, as the name suggests, is Vyagra. Vyagra is nothing but Kantakari. Vyagra means lion. You know why Kantakari is named as Vyagra? Because when the throat and the chest is congested and the patient voice is very feeble, he cannot speak properly because of the obstructed mucus. You give Kantakari to the patient's voice again becomes like a lion roaring. Hence the name Vyagra or lion. So it contains Vyagra Kantakari, number 2 Guduchi, number 3 Shunti, number 4 Pipali. Only 4 drugs are there in Vyagradhi Kashayam. So coming to the shloka of the Vyagradhi Kashayam, Vyagri Shunti Amrita Kwatha Pipali Churna Samyutaha Vata Skleshma Jwara Kasa Shwasa Pinasa Shulanut is the shloka. So as I said, Vyagri Shunti Amrita Pipali Churna Samyuta. These are there in the Kashayam. Vata Skleshma Jwara. It is mainly indicated in Vata Skleshma Jwara or lower respiratory tract infection. Shwasa Kasa Pinasa Shulanut. In all these conditions, body pain, lower respiratory tract infection, upper respiratory tract infection, along with the fever and body pain, exactly Vyagradhi Kashayam should be used. Coming to Dashamula Katutrayam Kashayam, obviously as the name suggests, it contains Katutrayam, Trikatu, Pipali Maricha Shunti, Dashamula, 10 mula, 10 roots which are, and Vasa. So these are the 3 ingredients, Dashamulam, Vasam, Katutrayam. Contains Dashamula Katutraya Kashayam. Coming to the shloka of Dashamula Katutraya Kashayam, Dashamula Katutrayi sa vrishescha kwatitam shaudram yuktam prapitam ambaha shwasa anilakasa parsva prishta trika murda sa rujastu sampratishtaha. It is mainly Dashamula Katutrayi sa vrishescha, contains Dashamula Katutraya Vasa. Shaudra Yuktam, it should be mixed with honey and Prapitam Ambaha, honey and water, it should be taken along with the honey and water. Shwasa, bronchitis and COPD, etc. Those conditions. Anila Kasa, Vataja Kasa, they didn't tell Kafaja Kasa, they didn't tell Pittaja Kasa. Anila Kasa. In Vataja Kasa, Dashamula Katutrayam should be used. What is Vataja Kasa? I'll tell in detail. When wherever there is extreme cough, Vataja Kasa, along with the pain in flanks, pain near the Trika region, Murdha region, and head region, etc. Wherever there is pain in the Urdhvaja through, along with the cough and lower respiratory tract in congestion, we should use Dashamula Katutrayam Kashayam. So, coming to the difference between Vyagradhi and Dashamula Katutrayam Kashayam is that Vyagradhi is Jwarahara, but Dashamula Katutraya Kashaya is not Jwarahara. Vyagradhi is given in lower respiratory tract infection where fever is a specific symptom. Vata Kafaja Jwara is the main thing. But Dashamula Katutrayam is given where there is Kasa and Shwasa, where there is obstructed mucus, little obstructed mucus, along with severe cough with pain in the flanks. Then Dashamula Katutrayam is bigger choice. Where there is lower respiratory tract infection with lot of mucus and fever, definitely Vyagradhi Kashayam is a main drug of choice. Now coming to Vyagradhi Kashayam, Vata Kapha Jwaram is a main indication. What is Vata Kapha Jwara? What are the symptoms of Vata Kapha Jwara? This is where we fail. Whenever we take a Kashayam, we only study about the Kashayam. We don't study the indication in detail. They will tell Sarva Jwara Haranam Shrestha, you will give Vyagradhi in everything. It's not like that. You have to study about the specific condition which they have mentioned. Now, what is Vata Kapha Jwaram? Nityam Manda Jwaraha, where there is very low temperature. Ruksha, patient is feeling very dry and very feverish with the swelling and stiffness and chest congestion and a lot of mucus inside. That is Vata Kafaja Jwaram. Where there is some Manda Jwara along with the pain, swelling, stiffness, etc. That is Vata Jwaram. That is where Vyagradhi should be given. Whereas Dashamula Katutrayam is told in Vataja Kasa. Now, what are the symptoms of Vataja Kasa again? It is Sushka Kasa. Very dry cough with a very little mucus that is coming at the throat. That is Vataja Kasa. There is not lot of mucus. there is very little mucus coming at the throat, that is Vataja Kasa. Swara Beda, patient has lost his voice. In the patient's cough, there is no voice. Where they cough like that, where there is no voice to the cough, or where there is no base to the cough, that cough is Vataja Kasa. Associated with Hritshula, Parshashula, Udarashula, Shirashula. All this you can see in the Dashamula Katutraya Shruti. They have told Parshva, Trikashula, etc. In Vataja Kasa also they told Hritshula, Parshashula, Udarashula, Shirashula, etc. So this is the specific indication of Dashamula Katutraya Kashaya. But unfortunately, most of the companies don't use proper Dashamula in Dashamula Katutrayam Kashayam. Only Trikatu is remaining. Dashamula is not added properly. Hence, it is acting only as an expectorant and mucolytic and not strengthening to the patient. It does not act on Vata because proper Dashamula is not mixed. In Dashamula especially, the Kashmiri or Gambari is not at all mixed in any Kashaya in any company. That is the sad truth. So Dashamula Katutrayam, what we are getting is very, very Pravara type of Dashamula Katutrayam. So it is very good that if we can prepare our own Dashamula Katutrayam Kashaya. So, coming to the difference between Jarahara action, Vyagradhi is specifically indicated in Jarahara, whereas Dashamula Katutraya is not. Both are expectorant. Both are kind of bronchodilatory action. Both expels the kapha outside. And Vyagradhi is less mucolytic. Vyagradhi is less mucolytic because it is kind of contains Guluchi and all, but it's Sikta. And it kind of solidifies the mucus. But Dashamula Katutrayam is more mucolytic because it contains Trikatu. So Vyagradhi is not having broader spectrum. In specific upper respiratory conditions and in most of the lower respiratory conditions, along with the fever and body pain, we use Vyagradhi. Especially during COVID time, it was ideal drug of choice. But coming to Dashamula Katutrayam, it has much more broader spectrum. In Urdhva Jatru, you have any pain, you have shoulder pain, you have headache, which is of Vata nature. Definitely you can use Dashamula Katutrayam Kashaya. In clavicle pain, in frozen shoulder, you can use Dashamula Katutrayam wherever you see a lot of Vata. Because Urdhva Jatru is Kafasthana and Vata is increased in Kafasthana. And Dashamula Katutrayam is Vata Kafaram is the best drug of choice for reducing the pain in Urdhva Jatru. Especially in sinus headache and other type of headache where patient tells, sir, I will have headache just after taking bath. I will have headache just after going in a bike or going in cold air, breeze, etc. I will have headache just after exposing myself. That kind of patients, you give more of Dashamula Katutraya, you will get exact results. So that is all about Vyagradhi Kashayam, Dashamula Katutrayam Kashayam. I'll meet you in the next Kashayam series. Thank you everyone.